Hey, welcome to the second video in my bandaging series. If you have not looked at the first one, Layers of a Bandage, please feel free to do so anytime. If you find these short videos useful, please hit the like button and subscribe to my channel. Let's start with the stirrups. Why do we apply stirrups, and should we always use stirrups? Take a few seconds here to think about the answers to these questions, and then we'll move on to the next slide. So the purpose of the stirrups is not really to hold up the bandage. It is to make sure that we can always see a couple of toes at the bottom of the bandage so we can assess how comfortable the bandage is. Think about this. If you're applying a bandage for an orthopedic reason, it's got to support the limb, it needs to bring the swelling down, whatever your reasons are. If you put the stirrups on to hold the bandage on, the bandage isn't really doing its work now, is it? It has to be functional. It has to support the limb if you want it to do its job. So don't think of stirrups as something to hold the bandage on, but just think of them as an aid to allow you to better assess the patient's toes and to allow the owners to better assess their dog's toes. Not everybody uses stirrups all the time. Some do. I pick and choose my bandages. I always apply stirrups when I have like a thick bandage to put on a dog. But if it's just going to be a ordinary, not too thick, soft padded bandage, I don't always place the stirrups. They can be a bit of a pain to pull off, pain to the dog to pull off the leg once you remove the bandage. So some people use them all the time. You don't have to. We're going to watch a series of very short videos on how to apply each layer of the bandage. I just want you to note that the technician who's applying this bandage does a lot of bandaging, and she does a fabulous job. Take a good look at her technique. I have changed mine to mimic hers since I've been working with her. So she starts with applying the stirrups to the medial and lateral aspects of the paw, and then she will apply her cast padding. Now she's starting a little bit above the paw to allow her to just anchor the bandage so the end doesn't slop. She comes down towards the paw at an angle and cradles the back part of the paw with her bandaging material. This tends to form a bit of a V shape at the toes, keeping them exposed. And now that she's got the foot well anchored, she's ready to go up the limb. Let's take a second look here. So when I apply stirrups, I like to put a tongue depressor between the two sticky pieces so they don't stick too much to one another. Now there she goes with the cast padding at an angle. She's coming down. She's now going to cradle the back of the foot, change the angle, cradle the back of the foot, and get herself that nice V at the front of the foot. When she goes back up, it's important to have 50% overlap and prevent the cast padding from bunching. One up, one down is usually sufficient for your average soft padded bandage. So one layer all the way up the limb and come on back down and stop at the toes again. Applying the cling or the compressive layer, she's got the same pattern, creating a V at the toe and cradling the back of the paw, but her compression doesn't start till she's at the distalmost part of the limb, and then she compresses all the way up the bandage again. And again with the cling, usually one up and then maybe one down is all you need. Now this is where the stirrup becomes applied to the cling at this point. It doesn't stick well. That's pretty normal. Let's take another look with the cling. Now we want to start at the paw. She starts a little bit further up just in order to prevent the bandage from unraveling or flopping. It's just a little neater and tidier. And look at the compression she applies on the way up. That's what you want. Nice, even compression. and one up, one down will work. She tucks the end in so it doesn't unravel while she finishes working. And the stirrups are applied or turned over to stick to the cling layer. So if you've watched my layers of a bandage video, you know that this is now when we apply the splint. After the compressive layer and before the protective layer. After the cling, before the vet wrap. Always, 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 this is where the splint goes. So let's go ahead and put one in. The Metasplint is made of appropriate length by snapping it at a notch or cutting it, and then make sure that the paw is cradled in the spoon splint itself. Now use tape to anchor or hold the splint in place. She likes to, I call it candy cane the tape up. That works really well. Or you could just place loops of tapes. Now she's going to use cling to further help secure the splint in place. Notice how she anchored the bottom of the splint by using the cling to go around, and now she's going to do the same with the top of the splint. There's no compression with this cling layer here. She's just anchoring the splint in place. Finally, the protective or vet wrap layer, again, she's just giving it that same beginning, little bit of a V at the front of the limb, cradling the palmar aspect of the limb and 50% overlap. And with this one, she's not adding compression. She is just covering her bandage. Now she likes to use this ultralight elastic tape at the top and the bottom of the bandage to prevent any of the cotton padding from sticking out, because dogs will pick at it, and to offer a little bit of support at the foot part. It makes your bandage last a little bit longer if they're going to be walking on it. Just to give you an idea of sizes that you may want to use in the different patients, the 4-inch cast padding cling and vet wrap we like to use for the medium and the large dogs. The 2-inch we use for small dogs and cats. And if you get those little wee, 2 kilos and less little dogs, we take the 2-inch cast padding cling and vet wrap and we cut it in half. It is easier to work with 1-inch bandaging material for those little wee dogs. Don't be afraid to add little bandage art to your bandages. It makes such a big difference when the owners see it, especially when there's kids involved. They just brighten up. They kind of forget about the big bill and the gloom that their dog's got a broken leg going on. It puts a smile on their face, and it's actually pretty good advertising for your bandage work. If you have found this video to be helpful, please hit the like button and subscribe to my channel. Looking forward to talking with you again.